our new patient numbers have crazily increased. We have a lot more friend referrals since starting your program. We no longer, I don't know if it's okay to say, but we're no longer doing any external marketing. I also use your posture recommendations without even talking about appliances. Has been very valuable. But I joined your program to see how I could help my son. Hi,
Ken,
Simon.
thanks for joining us. Today, I suppose, is an opportunity for us to talk a little bit about feedback on the program. For those who aren't aware, this is Dr. Candice Veneberg, a specialist pediatric dentist who joined my mentorship program over 12 months ago. Where in the United States are you?
I'm located in Scottsdale, Arizona, and my practice, I'm a pediatric dentist, and right next to my office is my colleague who's an orthodontist. So we have been working together for years, along with other orthodontists in the area. So we're co-located but separate practices.
Okay, fantastic. So with my program, Postural Orthodontics, has that broadened your view on what you can do or what you feel comfortable doing?
Absolutely, because over the years, as a pediatric dentist, would see children, I could see early on they were going to have orthodontic issues, and just basically waiting till the orthodontist would be able to see them 7 to 8, which, earlier that was early. That was early, and then I was researching and following people that were doing earlier intervention for airway issues. I have in my family, there is sleep apnea on my side of the family and my husband's side of the family. And my son was growing similarly to how my father-in-law has a recessed jaw. And so not only with the crowding, I was trying to figure out how to unlock the deep bite for my patients too. But my main motivation was, how can I help my son? And that's how I led to getting more information about early treatment for my patients and my son.
Unfortunately, there's not a lot of attention focused on general health issues such as sleep breathing disorders and general growth and development. So the program that I created actually seems to be targeting specifically, like yourself, mothers who have become aware that their children have malocclusions that are not necessarily class 1 based. Do you feel like the treatment that we've done using removable appliances, has that started to have an impact or benefit for your son?
Yeah, absolutely. One thing that for him, it's been a painless process having the removable appliance. The first week, with your guidance and your training, how you have to be strict, I learned to be a little bit stricter, and said you can do it. And I'd seen so many cases, and with your guidance, I've been able to do what I didn't think was possible. He's proud to be wearing the removable appliances, but working on the posture, I think, has been the biggest realization to me about how to avoid relapse, and I want him to continue to grow properly. But the more I go through the program with my son, I realize, I really, even though you said, oh, the posture is so important, I'm learning it even more so, because when he doesn't do the exercises, I can see that things starting to look softer. And when he does the exercises, he looks like a stronger jaw, and that we're getting better remodeling of the bone.
How have you found the format of, being involved in a group and everyone kind of putting in some input and sharing their own cases and then providing feedback as well as my own?
So initially when I joined the group, I was one of the doctors with the least ortho experience, because I hadn't practiced ortho in over any early intervention over 10 years. And I actually felt still very comfortable. Everybody gives nice feedback. We're listening to each other. I have enjoyed the mentorship, especially with other doctors on the call too.
And I think that's why we've limited it to a relatively small group, because everyone obviously needs to present their cases, and I have to spend time. But the vault that we've created of case reports, and every fortnight we record the information. Have you found access to the historical vault to be useful for your own learning?
Absolutely. I feel there's so much content in there. That first year, I think it was 2021, was very, very detailed. And I felt like I listened to those videos so I could be prepared and not kind of, you have to retell me. I try to take the feedback that you were telling other students about camera settings or just different tips with patient management, dealing, maybe coaching parents. Also, the vault, the way it's labeled, I could just search OpenBite and I could read other cases and kind of follow that history and some of the comments and maybe some challenges that other doctors had, and then you would make the comments. And then if I really wanted to even dive deeper, I would just look to see those dates and I would go back to the videos. I think that's valuable. It's kind of almost like infinite content that you have provided.
It seems like there's an infinite array of issues to deal with, but you can actually categorize them because they keep repeating and they keep repeating. And hopefully with experience and with time, you start to see the patterns, and then you start to be able to say, oh, that belongs in that category. What are some of the biggest challenges do you think you've had, and how you might want me to modify things so that it helps you overcome these problems?
Actually, Simon, I've really enjoyed the program. There's just been a few weekends where maybe my son has some things going on, and I actually like being on the full call. I feel even though I can watch the video, that I get more out if I'm directly on the call, listening to all the cases. Sometimes, oh, I have to go, and so you'll say, oh, okay, I'll have you at the beginning of the call or the end of the call. So that's been a nice addition for those of us that, when we can't be on the full call.
Are there people you feel who have a specific need that I can assist with?
I feel that especially those of us that are pediatric dentists, we are used to treating young kids, guiding young children to do hard things. And I think that actually, as those of us pediatric dentists or general dentists that see young kids, we have the capacity to guide a patient and intervene early so that we can set them up to have their either skeletal or dental malocclusions less severe the earlier we intervene. And the more I have presented this to patients in my office, the parents, at first they say, I don't think it's possible. When I talk about the benefits, they see they're starting to see the value. It is a little bit newer concept, especially removable appliances. When I talk about the posture and our goal to correct the posture so they can grow better, parents really, they see the value. I also use your posture recommendations in my pediatric practice alone in young infants and toddlers. Just talking about that in my practice without even talking about appliances has been very valuable. We have a lot more friend referrals since starting your program. We no longer, I don't know if it's okay to say, but we're no longer doing any external marketing. Our new patient numbers have crazily increased, I think, since I've really been talking about posture and air, even more so airway, because now I have the capability of giving some tools to the parents, like they can feel like they're in control, like, oh, I might be able to actually help my child instead of, oh, genetically I had this, so they're gonna have it. They're gonna have 5 years of braces like I had 5 years of braces. So it's been that part has been a huge practice builder with just and being able to identify why they have the malocclusion. The parents, it makes sense to them. Simon, I can tell you that the confidence I have in being able to, I'm, starting to look at the face and I'm like trying to guess the occlusion. I'm like, I got it right again. So that, showing that confidence in the parents, they can tell I know what I'm talking about. And I feel confident because I've spent so much time with you, learning it and listening to the videos that I'm like, I know this. It's been proven time and time again how you tell us to read the face. And I'm like, oh, it is. It's that same occlusion that Simon said it was going to be. That's exactly what's going on. So I'm able to read it and see it. And when you see it, it's hard to unsee it. You just want to change and help everybody.
Absolutely.
Yeah.
The moment you see the role posture has in growth and development, um, it's so simple. And when it's so simple, you can explain it so easily. And the fact that you've actually treated your own boy, then of course they're going to say, hey, if it's good enough for your son.
Right, exactly. So I'm very happy that, and now I'm offering it to my patients, and they're interested. So it's been a good, and I'll be around for a while because I have a lot more to learn.
Well, I'm very pleased to hear that I can continue to be a part of your education and your life and your family's life.
Yeah. Thanks for the mentorship, Simon. I'm glad it was available.
Oh,
It's
wonderful.
amazing, but it's amazing what we can do with Zoom across the ocean.
It's a pleasure to see the improvements that your boy has achieved.
Right.
And so
Yeah.
thank you so much for sharing, and thank you for the changes that you've made to improve your community. And I look forward to seeing you in New York and meeting live for the first time.
Yeah,
And
this will be good.
that'll be just wonderful. Thank you, Candice.
Thank you. Thank you, Simon. Bye. Thank
Bye
you.
bye.